Hi, this is Chad Clark, Physical Therapy Connections. You'll be seeing one of us here at Physical Therapy Connections for your initial consultation. What I want to do is we're going to get a patient's roll sheet. So we have a role to help you out, and you'll have a role to help yourself out based on what we can teach you and what we can show you in here. So I wanted to go through a couple main points so you're a little more prepared for that first visit. Number one, you have to do your part. We'll give you all the skills and the education, and then it's up to you to do on your own, at home, at work, on a daily or consistent basis. Number two, all our sessions are between 30 and 60 minutes. They do average about 45 minutes. Sometimes it's a little less, sometimes a little more. We want you to get the most out of it, and that's why it does vary, but the average is around 45 minutes. It is one-on-one, and so you can get everything that you need out of each session. Number three, most people we find will get better in 6 to 12 sessions over about 8 up to 12 weeks. And I know those are pretty big ranges. So we see some people once a week for 6 weeks if you haven't had surgery. If you've had surgery, more likely we'll see you 2 to 3 times a week for those first month. Then we'll spread it out to twice a week or once a week, covering the 8 to 12 weeks. And that's a popular question because people say, well, how long am I going to be here? How many visits? Pretty much 95% of the people we see up to 6 to 12 sessions, up to 12 weeks. Number four, appointments will go to those who want and need it. So if you need it canceled, please give us a 48-hour notice. It just helps us get that slot filled for someone that really wants to be here, and that's pretty self-explanatory. Number five, you'll sign in each visit. That has changed temporarily for certain reasons, but we'll sign you in and we'll do our check that I discuss in another video, our welcome video, of how the procedure is in the situation that we have right now. Number six, if there are any concerns with your cost of care at any time, please let us know so we can make this affordable, and again, so you can get out of it what you want and need and not feel pressure financially. Things that we'll also go through, it's a little more clinically related, what not to do. Real simple, any motions or positions that cause pain to the body part we're seeing you, or pain anywhere in your body, or if you feel unsafe or uncomfortable doing those. It's a general statement, but those are things not to do. What to do, we will go through that. There's a lot of specifics for you that we want to make. I just don't want to make general statements because we want to make it very individualized and so you get the most out of it. We'll also give you up to 3 things, probably never more than that, on the very first day, because we don't want to overwhelm with a big time commitment that you just don't need to do extra things that aren't going to really help you. We'll set goals and your results that you want out of it, so we will get to know you even better of what you really want. We know a lot of people come in with pain, but there's also something that's really limiting them, or multiple things that are limiting them from what they really want to do. For instance, just to bend down and pick up grandkids, or to be able to fish without shoulder pain, or to do something that they really enjoy without the pain because it makes them feel better. So we want to get to know you even better. After the first day, if you experience excessive soreness and it doesn't go away after 4 days, that could be a problem. But most of the time, you might have a little soreness because some things are provoked to get to the source of your problem and the source of what's causing your issues, so we can better help you. So you might have some soreness for a couple days after. That's even kind of rare, but it does happen, and we want to make people know. We'll go through some other things along there, but we want to make sure that you will have a patient's roll sheet that we'll give to you and clearly define everything and educate you as needed. And you can always ask questions on that first visit. After the first visit, we'll be sending you this through email and staying in contact with you through your whole plan of care, so we don't lose track of what you're really coming for to get the best results for you.